Well, it's good to be here. It's good to see us out here, and one thing that we do know is that we need more folks to join in on this issue. Because one of the things that's important that I think that I even lifted up this morning in my Sunday sermon, that there is no way that a country as rich as this should deny anybody access to health care, to holistic health care in this society. There is no other way to look at it. And you know, see, one of the things is that we need to talk about health care and the access to health care as a human right. And that everybody, I mean everybody without any question should be able to have it. I've known in my ministry too many people that have died because they did not have access to health care. When I was running for city council, and some of y'all remember that, when I was running, my campaign manager had breast cancer. Had breast cancer and had no insurance, and therefore never, ever went in to see about the situation until it was too late. And when we found out about it, we got her in, we pulled whatever strings we could pull through the church and through those that I knew in the church, but still it was too late. And in a society with all of the medical advances that we have, the fact is that we have made medicine a commodity. Are we crazy? Because whenever we make something a commodity, those who have are cut in and they control it, and those who do not have, they are cut out and they are made the victims, and they are exploited and they are robbed. And so we need to really begin to talk about this in a moral kind of issue, because everybody wants to play politics with it, and everybody wants to talk about what is achievable, and everybody wants to compromise based on what they think is achievable. But our role is not to be expedient. Our role is not to be political. Our role is to be moral and to lift up a prophetic voice and to say that in this society, everyone should be able to receive what is needed for their health and their life and their joy. Everybody. And so we need to really talk about holistic, universal health care. Holistic, universal health care, nothing less. Because one of the things I always remind folks, and as you know, I come out of a Christian tradition. And I come out of a Christian tradition, and one thing that you always see when you read the gospel are those who come to Jesus for healing. And not one is turned away. Everyone is touched and blessed and healed and lifted up. And we need to continue to force this society to deal with the issues that it needs to deal with, and that there should be no rich and poor, and there should be nobody who's left out, and everybody should have the equal opportunity. I want to say this before I go. It's important to lift this up, and all of us, we are very, very happy with the election of President Barack Obama. But you know the way politics work. Those who have money, and those, therefore, because of that money, who will have political clout, will be pushing and pushing and pushing so that they can win more, and we will get less. So, sisters and brothers, we need to give cover to the president by pushing and pushing and pushing so that we will win more and they will get less. It is up to us to push and to cause our moral voice to be lifted up and heard and respected. It's up to us to build the kind of people power that we need to bring health care for all into existence. God bless you, and continue to struggle.
Hello, everybody. Larry doesn't like to speak, so just give him a hand, would you, for being up here? He speaks plenty, but not to crowds. My name is Donna Smith, and my story was told in the very beginning of the movie Sicko. And I always share with people that story was not told because we have a unique story in this United States. It was told because we have a story that is not unique. Because so many millions of people are having the same story play out in their lives every day. Larry and I always had health insurance. I also purchased a health care disability insurance. And I also had a very small healthcare savings account. So we thought that we were doing everything you could possibly do to be responsible and keep yourself covered. But through some chronic illness, Larry has severe artery disease and heart disease. I then was diagnosed with cancer. We found out exactly what your health insurance will not do for you. So, we lost our home first because we did what a lot of middle-class families do. You find a way to hang on. So we sold that house first. And we paid off as much as we could. And then we lived in rental properties and lived in motel rooms, cooking ramen noodles in lukewarm water out of taps. We did everything you could do to hang on. I worked extra hours. And I want to ask everybody in this crowd, how many of you know what happens at 8 o'clock every night? What happens at 8 o'clock at night? The collection agencies cannot legally call you after 8 o'clock at night in this country. And is that what we want one another to know when we're sick, is that the only time you get peace from the collection agencies and the people who want your money is after 8 o'clock at night? That's what was happening to us. I would try and take those calls so that my husband dealing with heart disease didn't have to deal with them. I would take the phone calls, or I'd try and silence the phone until 8 o'clock at night and then turn it back on when it was safe again to be in our own home from those kinds of calls. So when I look at what's going on in Congress right now and what's going on in Washington, I ask myself a couple of questions. Is what this Congress is putting forward, will it prevent what happened to Larry and me? And the answer is no. Nothing this Congress is putting forward right now will prevent that from happening to millions more of American families. It just won't. Some of the coverage they would allow, they have a tiered benefit kind of plan that people may be able to buy into. And under one of the lowest benefit plans, you'd be able to have $11,400 in out-of-pocket maximums every year. That is not protection against bankruptcy, my friends. That is not. What they're putting forward will not prevent that. I also know many of you know I'm very blessed to work for the California Nurses Association and the National Nurses Organizing Committee. Some of the real warriors in this fight for single payer are the nurses of this country who stand with patients every day for no other reason, but it's their professional responsibility to advocate for the good of their patients. And what's interesting to me is one of the stories that we often told was about Natalie Sarkisian, 17-year-old girl in Northridge, California, had a need for a liver transplant. Her insurance company, her parents' insurance company, Cigna, said no. Her doctor said she had a 65% chance at life. The insurance company said, you have a 0% chance at life. We're not going to pay for that. As a consequence, a lot of nurses and a lot of people in the families community came forward and protested, and eventually Cigna capitulated and approved payment for this liver transplant, but it was already too late. Natalie was deep into a coma, her other organ systems failing, and she died before she could get that liver transplant. 17 years old. Do you think anything this Congress is putting forward right now prevents that? The answer is no. Nothing they're putting forward right now prevents more Natalines, more mothers and fathers from burying their 17-year-old children because an insurance company says no. And none of what they're putting forward keeps American citizens from losing their homes and going bankrupt. So it is not the plan this nation needs. It has nothing about courage attached to it and everything about pandering to the health insurance industry that's spending $1.4 million a day in this city to make sure that it comes out the way they want it to come out. So, I'm pretty strongly opinionated about this. The only thing that would prevent many of these problems for us would be a single payer system. This is not socialism. If it were, that would be okay with me, but it's not okay with a lot of people. Single payer is simply a good idea from the left, which is public financing, combined with a good idea from the right, which is private delivery, put together into a single system that's very centrist, actually, so don't let anybody yank your chain about this. There's nothing more American than supporting single payer. So join us Thursday, please, if you can hear me. Come to Upper Senate Park at 1 o'clock on Thursday. Help us raise the roof outside, or whatever roof we've got outside the Capitol building. Let's get in there and tell them we know what's going on. We know what we need. We need single payer. We all want health care. We don't want health insurance reform. We want health care reform, not health insurance. Thank you very much.